So we have completed the normal physiology of newborn, how the newborn is adapting to the various systems. Next, going into the condition essential newborn care. This topic also you have learned, maybe might have learned in the third year. So essential care of a normal healthy neonates can be best provided by the mothers, okay, under the supervision of nursing personnel or basic or primary healthcare providers. So mother is the best person who can take care of her own babies. That is the essential newborn care. The majority of time the baby is with the mother. So mother itself is responsible along with the other healthcare providers. Okay, so about 80% of normal newborn babies should be near to their mothers only. Only with those babies with problems will be admitted in the nursery. And what is a healthy newborn? A healthy infant born at term between 38 to 42 weeks should have average birth weight. So the baby should be born between 38 and 42 weeks with average birth weight, that is 2.5 kg normal birth weight, cries immediately following birth, then establishes independent rhythmic respiration and quickly adapts to the changed environment. So as the baby is coming from the intrauterine environment to the extrauterine environment, so there are a lot of changes in the environment like tactile, visual, thermal stimuli, etc. So many changes. So a baby should adapt quickly to the situation by maintaining spontaneous rhythmic respiration along with average birth weight, and also born between 38 to 42 weeks is called to be a healthy newborn. And what all are the immediate basic care? Okay, immediate basic care. So first and foremost care in the newborn is maintenance of temperature. So maintenance of body temperature, there are a lot of measures are there to maintain the normal temperature of the newborn, and there are various situations in which we can see heat loss from the newborn, as well as in the situation like cold stress, how the newborn is adapting by producing heat. That all physiological changes we have already seen. So it is very important to maintain the temperature. Next is establishment of open airway and circulation. The baby should breathe normally, and the circulation that also should be established. The fetal circulation should be converted into the adult circulation immediately after the birth. That also should take place. Then identification of newborn, that we have to we are seeing all these in detail. Then vitamin K injection and initiation of breastfeeding. So these all are the immediate basic care, that is maintenance of temperature, establishment of open airway and circulation, identification of newborn, vitamin K injection. The importance of vitamin K injection also already mentioned in the previous classes. Then initiation of breastfeeding. Okay. The first point is maintenance of temperature. So how we can maintain the body temperature of the newborn immediately after delivery, and what all are the care we have to provide immediately after birth of the baby. So as soon as the baby is delivered, we have to dry the baby immediately and place the baby under the radiant warmer. Dry the baby and place the baby under a radiant warmer. That is the first step. Okay. After the drying, we can cover the baby with a towel, and we can promote the skin to skin contact with the mother. Okay. And always make sure that the neonate's head is properly covered, because the head size is relatively large to their body size, and also they are having more surface area, and that will make them more prone to the heat loss. So drying the baby, especially the head, should be kept dry Okay, dry it and also keep it covered. And the next important point is rooming in. Okay, the rooming in means we have to keep the baby near to the mother always. The baby should not be separated from the mother unless there are situations. Okay, like any infection in the mother or baby is in an ICU, like that only. So these all are the immediate measures we have to follow in order to maintain the temperature of the newborn. Okay, drying the infant, keeping the baby under a radiant warmer, then encourage roaming in, skin to skin contact, okay, and proper mummification. Next is establishment of open airway. So majority of babies will cry immediately at birth. Okay, as soon as the cord is clamped and cut, the baby will cry. That is a normal physiological changes taking place. That is the first sign of respiration, the crying. Crying is the first sign of respiration or first sign of breathing in the newborn. And also starts to take the spontaneous respiration. So we learn in the respiratory system adaptation, some amount of interstitial lung fluid will be coming out as the baby passes through the birth canal. So immediately we have to do the suctioning. As soon as the head is delivered, okay, the health workers, the nurse should immediately suction the secretions. Okay, also the secretions will be coming out of nose, mouth, etc. So we have to do the suctioning or wipe the mucus from the face, mouth and nose properly. And that is also one factor that will aid in the breathing process in the newborn. Okay, that is the first step. And we can suction the mouth and nose by using bulb syringe. In some hospitals they are using bulb syringe in order to extract the mucus secretions, whereas we can use suction catheters also. Suctioning also we can do. And also place the baby with the head position lower than that of the body in order to drain the secretions. Okay, position the baby on their backs or tilted to their side. We can either provide a sideline position to the baby but not in the prone position. That means not on their stomachs. Okay, suction the mouth and nose by using bulb syringe or suctioning by the catheters. Okay, keep the head slightly lower than the body. Okay, head should be slightly tilted backwards. Okay, also take care not to place the baby on in the prone position. And what are the importance of suctioning? So there are certain natural mechanisms that is helping out in order to remove the secretions. That already we have seen that as the fetal chest or fetus passes through the birth canal, as the chest of the fetus is getting compressed against the birth canal, some amount of squeezing will take place that will remove the excess fluid out of the lungs. Okay, that is taking place before baby takes the first breath. Okay, so after several seconds in this partially delivered position, the fluid can be seen streaming out of the baby's nose and mouth. So after the delivery also we can see immediately after the delivery we can see the secretions. So as soon as the delivery of the baby, after the delivery of the babies usually will cough and sneeze because of the secretions. Okay, that will also mobilize the additional fluid that may be in the helping mobilizing the additional fluid that may be present in their lungs. These are some of the natural mechanisms. Okay, as the fetal chest is compressed as it passes through the birth canal, and another one is coughing and sneezing, that also will help to remove the excess secretions.